Healthier Together, sponsored by Regence Blue Cross Blue Shield of Oregon.
Because we really need to shine a light on the significant disparities in outcomes that are happening in the U.S. between Black moms and white moms.
Black women are 3 times more likely to die from a pregnancy-related cause than white women. April 11th through the 17th is Black Maternal Health Week, bringing much-needed attention and action to the racial disparities that exist within our healthcare system. I went to OBGYN and Executive Medical Director for Regence, Dr. Nicole Sinclair, for insight.
I think we've been recognizing and talking about the presence of these healthcare disparities for quite a while. So now it's time to move from acknowledging that they exist to just working really hard and diligently on the solution. And that begins with just awareness and sounding the alarms.
A recent report from the CDC shows the U.S. had one of the worst total rates of maternal deaths in the country's history in 2021. 1,205 people died. That's 33 deaths for every 100,000 births. It's a 40% increase from the year before, and 10 times the rates of some other high-income countries. But add in racial disparities, and it's even worse. For white women, the rate is 26.6 deaths per 100,000 live births. But for Black women, that number shoots up to nearly 70 deaths for every 100,000 births. And data shows 4 in 5 pregnancy-related deaths in the U.S. are preventable.
We have to do something. This is a big deal, but this problem continues year over year, and we're not moving quick enough and changing the numbers fast enough.
The reason for the disparities is multifaceted, and much of it comes down to societal factors.
At baseline, as humans, our bodies are all fundamentally the same. So we shouldn't think that there's anything about Black women that would predispose them to these types of outcomes. But through the variety of different factors, through life, society, we do see that this higher rate of hypertension and certain other conditions can translate to more pregnancy complications.
And Dr. St. Clair says unconscious bias can creep in and affect the way care is delivered.
And we also know that there's a communication disconnect. And we see that oftentimes when Black women are having a health issue or a concern, there can be a disconnect from the healthcare team of hearing and recognizing and responding to that concern in a timely fashion. And that can lead not only to misdiagnosis or delayed care and then potential complications.
While she says changes need to come from the top to address these disparities, she also encourages expecting moms to know your blood pressure and get screened for diabetes. Both of these factors can significantly impact a pregnancy. It's important to advocate for your own health. Find support through friends, family, and perhaps even a doula.
It's always challenging and unfortunate when you really need to have the space to just be the patient, to have to think about also kind of advocating for your needs. But what we do know is that within some of these communication disconnects, advocacy is really critical.
For more information and resources to learn more about Black Maternal Health Week, visit kgw.com/healthiertogether.